I want to thank everybody for taking the time to join us today. We understand everybody on here is busy. You're seeing patients, you're running practices, you're managing teams, and trying to basically deliver the high touch experience that makes your practice different. So for anyone I have not met, my name is Brad Schleier. I am the VP of Sales here at HealthBook Plus. And I'm also joined today by Ryan Wendling, our VP of Solutions and Success. So what you're going to see here today is Ryan's going to walk everybody through the platform and show what this can actually look like inside of a practice like yours. For a lot of you, we had the chance to meet at HIN Summit in Nashville a few weeks ago, and that was a great event for us. We had a lot of really good conversations, and one thing that really kept coming up was growth. A lot of practices are growing, which is obviously a great thing. But as you grow, that model can actually start to feel harder to manage. And that makes sense. But most of you built your practices because you wanted to do healthcare differently. You wanted more time with your patients. You wanted stronger relationships. You wanted to actually understand the person in front of you, not just rush through those visits and not just to react to problems that they're having. And I think that's what makes this model so powerful. But as you add more patients, more work comes with that. So, you start thinking about more messages, more records to review, more labs, more follow-up, more patient questions, more things that your team has to keep track of. And at some point, even when the practice is doing really, really well, the day-to-day work just starts to pile up. And that is really the wall we heard people talk about. It's not that the model is broken. I actually think this model is exactly what healthcare needs more of. The challenge is that the work around the model gets heavier as you continue to grow. And then you get forced into a tough spot. Do you add more people? Do you ask your current team to take on more? Do you start to slowly lose some of the patient experience that really made your practice different in that first place? That's really what we want to talk more about here today. And how do we grow without just adding more headcount? How do we give your team more leverage? How do we keep patients supported without your staff being buried all day? And how do we actually scale what you've built without turning this into the system that ultimately, and we heard this across the board, that you left? And that last piece is very important because nobody here really wants to build something that's going to feel bigger, colder, or more complicated. You want to keep that high touch experience. You just need to, you need an easier way for this to be delivered. And really, that's where we believe HealthBook Plus can help. The way we look at this is pretty simple. We give your team time back in their day. We help make every patient interaction smarter, and we help you support more patients without sacrificing that experience. Now, at a high level, HealthBook Plus helps bring the patient's information together. It gives your team better visibility into what's going on, and it uses PaiGE, which you will see here shortly, our AI companion, to really help patients and the care teams to get the right information faster. So instead of your team having to dig through PDFs, any portal messages, your labs, uploaded records, wearable data, random patient questions, HealthBook Plus is really going to help you guys organize that information and bring forward really what matters. So instead of every patient question turning into another task for your team, what you're going to see PaiGE can do is PaiGE can actually help guide that patient. You're going to be able to have support, education, and bring the right context forward when your team needs to step in. And instead of the patients leaving a visit or losing momentum, what you're going to see here is journeys can actually help keep them connected to the plan from an education standpoint, next steps, and really follow through. And I think that it's really important point for this group. Most of you are already delivering great care. That's not the issue. The issue is protecting that experience as you grow, because the more successful your practice becomes, the harder it's going to get everything done manually. And the right technology should not make your life harder. It shouldn't be creating more clicks. It should not be creating more work. It should not be another thing your team has to babysit. It should give your team time back. It should help your patients stay connected. It should make it easier to understand what is going on with each of these patients. So we want to show you what this could look like in your practice. So Ryan's going to walk you through the platform and show you HealthBook Plus and how it can support both not only you as a practice, but also your patients. You're going to see how all this information comes together, how PaiGE can help create better interactions, and how journeys can support patients between visits. So as Ryan goes through the demo, I would encourage you to think about your own practice. Where is your team losing time right now? Is it reviewing records before a visit? Is it answering the same type of questions over and over again? Is it keeping patients engaged after the visit? Every practice is a little different, but I think a lot of you are probably feeling some version of the same thing. Obviously you want to grow, you want to support more patients, but you do not want to be continually adding more people every time the volume goes up. So what I'd like to do at this point is I'd like to hand this over to Ryan. Ryan's going to show you what this can look like, again, for your practice in action. If you want to grow, get more leverage, keep patient experience at the center. So without further ado, I'm going to hand this over to Ryan.
Yeah, I appreciate it, Brad.
Sure.
So probably the way that I'll do this is kind of just walk through how this system might work for you all in a typical clinical encounter, and how this can really be powerful as you go through and start managing these populations. And so kind of the foundation of what we do at HealthBook Plus is built on two pieces of information coming together to really form a foundational understanding of what's going on with a patient at any point in time. And we call these the point of service data, but then also the point of living data. And really when those two things come together, it gives us a pretty incredible understanding of exactly what's going on with people in their health day to day, and provides you with the insights that you need to be able to treat them in the best way possible. So when I talk about point of service, this is kind of what you would think of as anything happening in a traditional healthcare environment. And so these are records, these are labs, these are imaging. This is all of the stuff that's happening when somebody presents into the healthcare environment. And we can really help out your practices in distilling all of that information, gathering insights from all of that, because we've got a multi-layered approach to being able to bring in those records, process them, look at them longitudinally, understand how they react and how they interact with one another. And all of that's done through our AI medical partner named PaiGE, who you'll see kind of throughout as I go through this. So we have links into the National Health Information Exchanges that allows us to bring in a really good bulk of data on your patient population, really with no work for you or for your patients. And so that's usually a great kind of foundational layer. We add in EHR integrations, and we'll even fax for records when it's necessary, or you can even just upload documents in your system, or your patient as well can upload documents on their end if they need to as well. And so all of this serves as a really great foundation for the system to get an understanding of what's going on in your patient's health. And you can imagine being able to bring all of this in right up front, quickly, easily, can also save you and your staff a ton of time in record retrieval, record review. It's now all accessible to PaiGE in a matter of minutes. And now anytime you're asking questions, PaiGE is right there to support you. Now we're a little bit unique is that we then layer in what we call the point of living, which is, okay, let's get an understanding of what's going on with these patients on a day-to-day basis, which as we've talked to DPCs, and it's really been a foundational market for us in terms of this was where we really wanted to partner and build the future of healthcare. I think this is one of the big promises of DPC is just that there's more time for the patients. There's a much tighter relationship. We can actually take a look at what's going on with these patients at a more foundational level instead of just treating them each time that they come into the office with a respiratory illness or managing a chronic condition. And so all of that is largely done through our patient mobile app. I'll touch on that sort of towards the end. And just to kind of give you the lay of the land, we've got clinics all the way from being 100% of their patients, they are committed. They want every single one of them into the app. Sort of in the middle is like, I'm going to give it to those individuals that I think are really going to, make good use of the patient application. All the way, we even have some clinics that say, there's plenty of information coming into this clinician portal. This is going to save me hours and hours every single week. I'm just going to leverage the clinician portal, and maybe we'll prescribe the app to certain patients over time as we think they need more support outside the office. So as you think through this, you'll see a lot of what we call point of living data for my profile here, because I am an app user, but I'll tell you there's a ton of value that can be had just with some of those foundational elements of having PaiGE interacting with all of this data that's coming into the system and driving insights off of that. And so typically how a standard visit will go for most of our clinicians is, let's say I'm about to go into the room with a patient, I'm scrambling between visits, I'm trying to get my mind switched over to this new patient. I can run a recent activity here on the left for any time period that I'm interested in, and this will give me a really good understanding of kind of what's going on in their health. And so I can see, any healthcare visits they've had. Have they had any medication changes? Have they had any labs or diagnostic tests done? How are they doing on a day-to-day basis with, health metrics and anything that the patients are reporting? And then finally, you'll see kind of patient instructions in here. These go out to the patients and inform their experience within the mobile application, but you'll also be able to see here evidence of compliance with those patient instructions. So if you're working with somebody on a healthcare journey, let's say you want them documenting how they're feeling on their new medication or how they're doing with their weight loss plan, their diet, whatever it is that you're working with them on, the system will actually proactively keep an eye on that and give you an idea of how they're doing. And then finally, we'll kind of summarize it and give you a really great final snippet for you to go into that room. After that, you're now, in front of the patient. We've got an AI scribe that we work with very closely. It comes with our partner, or it comes with our platform, and we've had just incredible results with this workflow. And so most of our clinicians come in here, they start the AI scribe chart note right at the beginning of the appointment. You can set up any kind of note templates that you like. If you have a gold standard note that you've written at some point, you had 2 hours after a visit to sit there and think about your note. We can take that, put it into the system, train it up to take the notes exactly the way that you want them. And then from then on, you can just have conversations with your patients, paying full attention to them, not worrying about the notes that'll be taken by the AI. And so most of our clinics make really good use of this and start this right at the beginning of a visit. And then honestly, from there, the vast majority of the experience for clinicians or the way that they're interacting with the system is simply by interacting with PaiGE. And so with PaiGE here, all of that information, all of that data that I talked about earlier is in the system, sitting there waiting for you to ask about. And so this can really be anything from as simple as, I'm looking for this record, go find this record. I need to know what's in it. My patient just reported, oh yeah, I actually had a knee surgery 4 years ago and I can't really remember what happened. Okay, I need to go hunt this down. All I have to do is come in here and ask PaiGE, right? So all the way from that very simple thing, all the way through to, I want a care plan on this patient. I want to come up with potential differential diagnoses based on the symptoms that they're experiencing. I want to figure out how I can help this person on their health. So really PaiGE shines, I'll say, in those scenarios where you just ask completely open-ended questions and let her go and process all of that data. One really incredible example that came up recently that I think just shows the power of PaiGE in this fashion is we had a doctor recently that was seeing a patient. This patient was having heart palpitations, some racing heart, and now that patient also reported that they had just increased their caffeine intake because they recently took over a family business. They were highly stressed. And so, of course, the doctor immediately is thinking, okay, stress, anxiety, cardiovascular, maybe at worst case. And so, but at the end of that visit, before the doctor kind of sent this person on their way, they just asked the open-ended question to PaiGE of, this is what I think it might be. Give me some other ideas of what this potentially could be. And one of those bullets came back from PaiGE and said, 3 years ago, you actually ordered labs for this patient for their thyroid, and this patient actually never got those labs drawn. Basically, PaiGE said, I think you might have been on to something. Their calcium has actually ticked up slightly over time. This might be something that you should really go get those labs done, make sure that it might not be a thyroid issue before you consider some of these other things. And so, sure enough, this doctor's like, oh, that's actually interesting. And yes, we should definitely get that lab done. Well, more of the story, to make a long story short, that patient about a month after that was having a resection of a tumor from their thyroid. And in talking to this doctor just said, and this is an incredible, incredible doctor, and as good as you're going to find out there. She said, you know, it probably would have been 6 months before I caught this without the use of PaiGE. I would have probably sent them out to a cardiologist if the symptoms kept getting worse. We would have gone down this whole pathway trying to figure out what this was. And in one kind of foul swoop, me asking this open-ended question to PaiGE was able to come back and give me something that I wouldn't have been able to make this connection in my mind in the middle of my day as I'm seeing patient after patient. So this is just one highlight, and that doctor now is like, honestly, I won't practice without this. It's borderline, like I feel like it's moral. The only way I can practice morally is to have PaiGE as my assistant looking at all of this. And so we've now got this obviously big believer in the system. But like I said, it can really be as simple as, okay, I see that Ryan had an ER visit. I can come in here and say, give me details of Ryan's ER visit from December. So instead of me having to call that office, send faxes, receive faxes, read through reports, try to figure out what happened, talking to the patient, even in front of this patient now, I'm able to just interact with PaiGE, see exactly what's going on. And the system just gives me all of the context that I need. And from here, you'll see this come back. I could then ask any follow-up questions, right? So as I read through this, okay, get kind of the overview, makes total sense. But I really want labs. And so I'm just going to ask for labs from the visit, right? Super easy. And then you can imagine how far I can take this, right? I can then say, build me a care plan to help Ryan recover from these stomach issues that he's been experiencing, or let's go ahead and document or trend his labs for these 3 labs over time, so that I can see how those have changed over time. Really, the potential is super open-ended. You can do so much with the system, and it can run reports. It can do basically anything that you can imagine, because it's got all of this medical training in it, but combined with the power of AI of being, open-ended and allowing you to do what you need within your workflow. So let's say in this case, I asked it for a recovery plan for the patient's stomach issues. I could then actually put that right back into patient instructions. And if this individual were a user of the mobile application, this would actually adapt their entire experience within the mobile application to these patient instructions. And so they'd be getting reminders, they'd be getting information that supports it, journal prompting, everything to keep them really compliant with what I'm kind of prescribing here in my patient instructions. So that's kind of how the entire visit kind of sums up. And then I can click pause or stop on my chart note. It generates my note for me. I pop that into HealthBook and/or my EHR, and I'm done. It's now this super efficient, super knowledgeable experience, and really allows me to see more patients without having to add more and more overhead, more and more staff to be able to do that. Some other things I'll highlight in here is we've also got a conversations platform. And so you can imagine how this works is very similarly. We'll take that exact same example. If Ryan in their mobile app is asking, how they can, recover from these stomach issues that they were having. Let's say they have an hour-long conversation with PaiGE, because we all know those patients that are in ChatGPT all day or Googling all day trying to figure out what they can do in their health. At any point, either if Ryan's getting a little bit too aggressive on the questions and it's moving into treatment and diagnosis realm, or if Ryan just wants help from the clinician, they can actually just ask to loop me into the conversation. And PaiGE will actually button up that entire conversation into a single, easy to digest format. She'll pull in any related records, any related data, and kind of button it up for you in a way that, when this comes across your desk, we hear all the time that people are waking up to a whole host of messages that have very limited context. They then have to go through triage. They then have to figure out what's been going on. This really buttons it all up, provides it over to you. And then as a clinician, you can look at it and say, yeah, I actually agree with everything PaiGE suggested, or hey, I really need to see you in office, or really whatever that follow-up is. You've now been able to process that super quickly. And another thing that she'll actually do is she can also take, we've been hearing, 30, 40% of questions just totally off your plate, because now they've got this medical partner in their pocket. And so some of those more basic questions that just really don't need to go to you, not only will she triage to answer or to, get more information when it does need to come over to you, she'll also try to help answer those questions when it's not necessarily, not necessary that it comes across your desk. And so super powerful. We're starting to hear some incredible feedback from market as we've launched this. Another thing that I'll mention that's a recent addition to the system, we've also got video visits now. And so you can actually hop into video visits with your patients directly from the HealthBook Plus platform as well. I'll highlight some other functionality in here before we kind of jump over into the patient side, so you can see that side of the house as well. There's always a summary of the patient's health history there and ready. You can always export that out. Let's say a patient's going to a cardiologist or seeing a new specialist. You can always provide all of this data that's been gathered here. It can go with them, whether via their mobile app or if you want to send it separately. And so it's just great to kind of centralize all of this information in a single spot to be able to travel with those patients from then. Any assessments that they're taking in app or in the system, PaiGE is aware of all of this information across all of these screens. And so you can always just ask PaiGE. But if you ever want to dive a little deeper, mental health assessments, physical assessments, nutrition assessments, there's things in the app that you'll see come across here. We do some proactive health monitoring for immunizations and preventive health. So all of that data that's coming across, the system automatically scans that versus the patient's personal profile, male, 34 years old. Okay, what might they be out of date for? And then document center. So both on the patient side and on the clinician side, we have a document center, and either you or your patients can upload any documents that you have related to health. And so this can be, independent labs that were drawn, or, anything related to health can be added here. Kind of another interesting point that we're starting to move in with this, and we're seeing some really great success in proposals that are going out to actually employers. And so we're able to load in benefits information. We're able to load in what point solutions, what kind of payment schemes are set up in the plans for these employees. And you can imagine being able to offer this health, wellness, benefits navigation as part of your practice out to these employers. It's become this really incredible offering, and it really seems to be turning the corner as a lot of our DPCs are trying to target employers and work with employers. So really a sneaky, powerful feature there. And then journeys, I'll probably touch on a little bit more strongly over in the mobile application, but basically journeys you can equate to a next generation of programming. If you consistently are sending the same information out to your diabetics, or sending out a weight loss platform or a program, or you're working with your GLP-1 patients on the same way every single time, all of that you can actually put into these journeys. They'll be delivered to the patients, and it actually gets personalized to the patient's health profile is the really cool thing. So it's not this bland, impersonal program being sent out. It's actually this very interactive system that allows them to really latch onto it. So I'll show a little more when we get over into the mobile app. And then finally, all of their data that is coming across, whether they're journaling, whether they're in the app or not, all of that comes in directly. And so this includes wearables data, connected medical device data, journaling, really anything that they're interacting with the patient app on, it comes in automatically. And PaiGE is obviously aware of this, so you can trend all of this over time. You can see how their activity level might be relating to their weight, might be relating to their sleep, might be relating to their labs, might be related, you can take it so incredibly far to gain real insight into potential opportunities for improvement for your patients and different ways to treat them or diagnose them as well. And so I think with that, we've pretty well covered the clinician portal. Brad, do you think there's anything else on that side of the house we should touch on before we switch over?
No, I think it's okay to switch over. One thing I want to remind everybody, we do have Q&A in here. You are able to populate questions into the chat. And then what we'll do is by the end of this, we'll start going through some questions because it looks like there's a common thread that's going through on some of them. So Ryan, we'll let you take it over to the patient side.
Yeah, perfect. Thanks, Brad.
Yes, sir.
We will switch over into the patient application now. And Brad, sorry for making you stare at yourself there, but so this is kind of the experience on the patient end. Again, some clinics use this as kind of a prescription to certain patients that they know are high utilizers or need some extra support. Others say, this is my conversations platform. This is where I want to communicate. This is where I want to do video visit. I want my patients to have all these insights. This is super critically important. I'm making sure every single patient downloads this when they're in the office. But more of the story, it's really up to your practice. It's up to your workflows. We're here to support you the way that you need support. And so I just encourage a conversation if you're kind of wondering where you might land kind of on that, or if you need more information on how we roll this out to your patients. Obviously, we really want to see this in the hands of patients because we've all seen the power that PaiGE can bring on kind of a personal health stance. But we also understand that clinics have different priorities and are super busy. So we want to meet you where you're at. But if a patient is using the app, they get all of that foundational information that we were just talking about, all of that point of service data, all of that point of living data, all buttoned up into one experience. And then they're getting insights on all of that data on their health every single time they log in. And so they can see, potential trends in their health. This is making a connection between some shoulder pain that I've had and maybe how it might impact my sleep quality. I'll tell you one story with this. I've had a vitamin D deficiency for years and years and years. And in my kind of classic health system, primary care experience, it keeps coming up on labs every year. And given I look like a decently healthy guy, my doctor says, and she's a good doctor, says, you've got a vitamin D deficiency, maybe consider some supplementation. I'll see you next year. And that's always been about it. That's all I've really heard about it. I've never understood why it might matter. And so, of course, I'm not going to supplement. I might do it for 2 weeks. I'm going to drop off after 2 weeks. I don't understand why it might be so important. Well, one of the times, this key observation, actually, I'd been complaining because I'd been sick for legitimately 4 months straight. I've got a young daughter at home, so it's not unexpected, but I was literally just journaling and said, man, I'm sick once again. I said, Melissa, who the system knows is my wife, never seems to get as sick as I do. She recovers way faster than I do. It's my immune system stinks, I think is basically what I said. And the system came back and said, the next time I logged in, said, I don't know if you're aware, but there's actually been clinical studies that have shown that vitamin D deficiency can impact the way that your immune system can respond to respiratory viruses. This might help explain some of the difference between you and your wife. Talk to your clinician if you have any questions, and here are some lifestyle-based approaches that you can take to better manage your deficiency or to try to combat that. And man, this one insight for me made this connection in my health that really changed the way that I was managing that deficiency and the way I looked at it, and was just super powerful for me. And since then, I've taken it much more seriously, gotten on a more much better supplementation schedule, been following those lifestyle medicine-based approaches to help combat that. But that's really just one example, right? And you can imagine for an individual that might have a very complex, they're on multiple medications, they're all affecting them differently. They've got a bunch of medical conditions, they're trying to figure out what to do. Or even for those longevity people or those people that are just trying to optimize their health or optimize their performance, the system can really be their partner in that journey. So these patients also have access to PaiGE directly. And so at any point, they can come in here and ask PaiGE any questions that they have on their health. She's medically trained. She knows where to go and where not to go for information. She's not going to go to that influencer. She's going to stick to, medically reviewed journals. And then she also, like I talked about before, if a conversation ever gets a little bit too far into the weeds, I'm starting to get a little bit too prescriptive, or I'm starting to talk about, oh, I can change my medication, right? She's going to then kick those kinds of conversations across to you as the provider and say, I'm bringing you into this conversation with the patient's permission, and then you can obviously take it from there. But it's pretty incredible. I mean, everybody so loves wearables, loves the data that's coming out of them. But really, if you look at them, a step count over the last year tells me next to nothing about my health, right? But when you pair that step count up to, okay, how's your sleep doing from your Aura Ring? How's that correspond to maybe other things that are going on in your health? How are these two medications I'm taking potentially impacting the way that I feel every day? These are the kinds of insights that really power people's health. And that's exactly what we do at HealthBook, is provide those sorts of insights that really look at the whole person and their entire health journey. And so speaking of journeys, like I kind of hinted at from the clinician portal side, you can build out, and we've got some stock journeys that are available for you, but you can also build out these programs for your patients. And so you can put next to any information in here, these can be multi-step processes where maybe somebody watches a YouTube video and then they answer a couple of questions and then they, interact with a form or a sheet. All of that can be done right within these journeys. And the cool thing about them, for instance, this one's on sleep management. And my question was, okay, well, how can I practice good sleep habits with a 19-month-old that wakes up often overnight, right? I mean, okay, cool, you're teaching me how to manage my sleep, but that's not necessarily perfect for everyone. And the cool thing is the system kind of understands that, right? So the system understands what's being delivered to me and then is able to help me understand it within the scope of my own health. It knows that I have a wife, for instance, so it brought up, tag teaming strategies, okay, well, how about you work with your wife and try to do that way? And so I can now interact with this, and it's kind of adapted to all of my health information. So it becomes this really adaptable, personalized experience for me that, has never been available in traditional healthcare. And you can imagine, let's say a diabetic, but you create a diabetic program. A diabetic isn't a diabetic, isn't a diabetic. Somebody that's well controlled is going to have a very different experience in here than somebody that is really struggling, right? And maybe has a bunch of comorbidities and is struggling across the board. And so that's where the power of PaiGE shows up, is you can make one diabetic journey. That journey is going to adapt to the way that the individuals are feeling, or how they're doing in their health and what else is going on in their health. So they can also come in here and journal, right? They can document how they're feeling day to day. They'll get personalized journal prompts in here that are based off of your patient instructions. So this is just another way that they're feeling super supported by your clinic, is they're like, wow, these people really are paying attention and really are supporting me. You've got lifestyle vitals in here. So we really believe in getting to the foundation of health. And it's interesting because these are just qualitative metrics, right? It's a 0 to 10 Likert scale, but you start combining these trends over time with that quantitative data that's coming from wearables, from connected medical devices, and then pair that up to what's happening in healthcare visits. this can really provide some super interesting perspective on where people are at in their health, and it provides a real opportunity to step in and help at times as well. And then on the record front, so there's just some really foundational value of individuals being able to see what all is out there in their records. We see a ton of inaccuracies in the data that's out there in the ER. I had somebody on my team that was actually marked as a drug seeker in her records. She does not enjoy opioids, does not do well on them. And yet, for some reason, at some point in her medical history, somebody clicked a button, and now it has followed her for years and years and years. And she's always wondered why she gets spoken to a certain way when she's going in for surgery or when something's going on. And sure enough, once she joined HealthBook, she was able to see, well, now that all makes sense. That's not accurate. I'm going to get that corrected from my record. And the other real value to this is, wherever I go now in my health, let's say I'm traveling and I end up in some random hospital, even overseas, I can code a page and say, generate a health history for me in French because I'm in a French hospital. Let's send them that. For me, when I had this ER visit, it was actually in a system I had never been to before. And they just started treating me. They took very limited time to get to know what was going on. And I was able to say, hold on just a minute. This isn't just some acute situation going on. I've got months and months of journal entries about how my stomach's been feeling. I've got, it's been going on for 6 to 9 months. And I actually just exported my record to them, and they were able to really understand the full picture of what was going on in my health. So it's really powerful just having this right in your hands. And then, as I touched on previously, this can be just an incredible tool for selling to employers. We can go in there and load any point solutions that they have into our health hub, and then PaiGE is aware of all these. So you can imagine if they've got an AI musculoskeletal platform, PaiGE can pop up, maybe they just got diagnosed with a bum knee. PaiGE will pop in and say, hey, did you know you have access to this AI musculoskeletal platform? So these employers are developing, especially the ones working with DPC, they recognize we need to do a lot better in health. And they're a lot of times building these great offerings. But if you don't get patients to those offerings at the appropriate time, which, people in their daily lives just don't remember what they're supposed to do. It's 6 months since open enrollment. So PaiGE can really help to navigate people into those solutions at the appropriate time, keep them using you as their DPC, as kind of the front door to healthcare. And it can just be a really powerful sales tool for you all as we go out as partners and talk to the employers in your markets. And so with that, buttoning it all up on the clinician portal side of the house, it's all about getting such a better understanding of your patients, but also saving you just a ton of time. And we know how busy, clinical life gets, and being able to take gathering insights and really automating that and making it so much easier to get records in the door, understand what's going on, thinking about differential diagnoses, thinking about care planning. It really allows you to be that clinician to your patients that, as we've talked to DPCs, it's totally consistent that a big reason that they've gone with this model is just because they really believe in this form of healthcare that is way more personalized. But if you don't have the time to do it, it's really difficult. And that's where PaiGE can be this partner for you and really help to allow you to expand your practice or have more time in your evenings, or however you want to use that extra time that we're giving back to you. She can be that partner in it, save you time, allow you to care for your patients the way that you'd like. And then, of course, it's your option, the amount that you roll this out to your patients and provide that value directly to them as well. So with that, Brad, do you think there's anything that I'm missing as we talk through this? And then we can look at some questions if we have any.
No, I think that was great. And
Awesome.
hopefully everybody can start to see how this is coming together. The goal here is not to throw more technology at your practice just for the sake of it. I think the ultimate goal and the biggest takeaway here is to give your team more leverage, help your patients stay connected, and make it easier to deliver that kind of care that you already want to deliver. Before we do wrap, I want to hit on a few questions that have been coming up and maybe coming up for some of you. So these are the types of things that we heard at Hint, and they're probably questions that I'd be asking too if I were sitting in your seat. Unfortunately, I'm not a doctor, so I will not be sitting in your seat. But first question, is this meant to replace our EHR? No. That's a very important point. HealthBook is not trying to be your EHR, so your EHR can still be your system of record. That's where you can still do your documentation, your billing, your core clinical workflow can stay. Where we fit in, though, is around the EHR. So what we do is we help bring in the patient's information together. We're going to make it easier for you to understand what's going on. We're going to be able to support the patients between the visits and help your team get to the right information faster. So I would not think of this as replacing what you already have. There are a few practices that are starting to consider doing so, but I would think of it more as giving your practice an intelligence and engagement layer that's going to help your team move faster and support patients better. Ryan, this one's for you. How much work does it take to create this for my team? How much? I'm sorry. How much work does this create for my team?
Oh, great. Yeah. Well, I'll answer both questions just in case they're out there. Yeah. So in terms of kind of an implementation process, we come alongside and partner with you from the very beginning. We actually really look to get 30-minute blocks on your calendar for about the first 6 weeks. A lot of times we don't go the full 30 minutes, but we really want to make sure that by the end of those 6 weeks, by the end of that 3 hours max that you're spent with us, your team is just absolutely up and rocking and rolling. And so that's kind of what the process looks like. It's really quick to onboard you. So doesn't take much time at all, but would welcome any additional questions on that front. And then what was the other question?
How much work does this create for my team?
Yeah, it actually doesn't. I mean, we really designed it to take work off of your plate. So all of that chart chasing that you're out there doing, that's going to be very largely diminished. The record review, trying to answer questions that come in the middle of the night that might not have been super appropriate, or at least if they do actually need to come to you, you're getting full context so you can answer that question in 30 seconds instead of taking 5 minutes to thumb through the record and understand what's going on. So
cool.
We really do see, and we regularly get docs or clinicians that say, we've heard 5 hours a week is kind of a good number to think about. So it can really save time.
Cool. I'll take this one. You had mentioned that this could help us scale without adding more staff. How? Okay, so the way I would think about this is from a leverage standpoint. So HealthBook Plus does not replace your team. It's going to help your team carry more without burning out. So if your team is right now spending tons of time digging through records, you're answering repetitive questions on a daily basis, which we're hearing happens a lot. If they're manually sending any resources, tracking follow-up, or really trying to piece together any patient information from different places, that work is going to add up fast. So what we do is we're going to basically help organize that information. We're going to support the patients between those visits, and we're going to surface the right context faster. So your team, from a scaling standpoint, they can spend a lot less time chasing that information, a lot more time actively helping patients, and that is where the scale starts to become much more realistic. Here's one for you, Ryan. Ryan, can we customize this to our practice?
Yeah, there's actually quite a bit that we can do for you, and then we've actually got some really exciting features coming that'll kind of further enhance it. Journeys is a really easy example, right? You can build those out fully custom to your practice. From like a marketing standpoint, the app can actually be white labeled to your brand. And so, when patients are logging in, they're getting a reminder every time, oh, wow, XYZ DPC is providing this incredible service to me. So we could do some of that marketing with you. And then we've also got things like org level documents that's coming that will allow you to provide PaiGE context on the way that you run your practice. Let's say you're a functional medicine practice, PaiGE will take that context and start interacting with you and your patients in the way that a functional medicine doctor in practice would. So any of that additional context can really soon be fed into PaiGE and allow her to adapt to the way that your practice runs.
Cool. Here's one I'll take. And then we got one more after this. So we're coming up to an hour. That's perfect. How should we be thinking about ROI? Great question. We actually get that a lot. For DPC DPC practices, I think ROI usually comes down to a few things. So think time back for your team. You're going to have better patient follow through, more efficient onboarding. You're going to have less manual record review, better support between visits. So those are the top 5. And I'd also say the ability to grow without immediately adding more people. So I don't think the ROI is just one thing. It's operational, it's clinical, and it's business related. But if HealthBook Plus, helps you save time for your team, you're going to be able to support more patients and protect the experience that really makes your practice valuable. I think that's where the business case really starts to become clear. Okay, this is a great question. What are the next steps if we are interested? Ryan, I could let you take this, or I can handle this, but I
reach out to Brad.
Yeah, you can reach out to me. I think the next best step is usually a more focused conversation around your specific practice. Now, I know this webinar gives you a very good overview, but I think the real value comes from understanding your workflow. How many patients are you supporting? Where's your team losing time? Are there any programs you're trying to grow? What tools you already use? Where do you feel the most pressure today? From there, we can really recommend a great starting point and then talk through really what a practical rollout would look like. That is the last question. So I think to wrap things up, I just really want to bring it back to where we started. A lot of you are building something really special. You're giving patients more access, more time, more trust, and a better experience than what they're probably used to getting in a traditional system. But really, growth creates pressure. More patients means more work means more strain on the team. And if you're not careful, the exact thing that your practice can specialize in, it can actually start becoming harder to maintain. I think the problem that we're focused on is helping to solve is we're about giving you guys more leverage, as we had already mentioned before. So really appreciate everybody joining today. If something you saw really feels relevant to your practice, would love to continue that conversation and really learn more about what you guys are trying to solve. And we can definitely set up time to go through your workflow, your patient population, and where potentially we might be able to help you the most. So I want to thank everybody once again for joining. Ryan, thank you for your time today. We really appreciate the time, and we're excited to keep the conversations going.